Well, it's summertime, and sometimes that's the time of year when we start thinking more about our weight and how we look. And we're going to talk about weight management program at Mercy Health St. Rita's. Joining us, Dr. Jason Bowersock, bariatric surgeon at Mercy Health St. Rita's. And thanks for joining us, doctor.
Thanks for having me.
Okay, so what about weight management solution programs? What kind of things do you guys offer to help us manage our weight?
So the program's kind of comprehensive. As far as the backbone of the program probably would be our dietitians, to where they really will work with you in regards to nutrition. They'll talk about what you eat, when you eat, how much you're going to eat. They'll look at calories, how many you need. They'll look at energy expenditure and try to really get you on the best dietary program that you can be on from a nutritional standpoint. And they really involve also some of your other comorbid conditions, if you have any, such as diabetes or blood pressure issues, to try to correlate your diet with that as well to try to be successful with weight loss. On top of that, we do have a fitness center here. So we have fitness trainers that get involved to try to improve your exercise and activity, to get you into some kind of a fitness routine. Especially during the summer months, it gets a little bit easier. But even during the winter months, we do have the fitness center here to where they'll, again, not just kind of a one-stop shop where they're all the same routines or exercises. They really will correlate it with your medical issues, if you got a bad hip or a bad knee. And if you're not quite to the fitness center, category, I guess, as far as if you're, severely overweight, really bad joints, we also have physical therapy and occupational therapy here to start at that pace. On top of that, we do have obviously weight loss medications. Those oftentimes are a really good adjunct to go with the improvement in the nutrition and the exercise. And then if you go down the category, then we can get more aggressive if you need even more weight off, to where we also have the bariatric surgeries here.
Mm-hmm. So you've got the whole scope of it. And you mentioned medications. It seems like that's a hot topic right now, about one of these weight loss medications on the market, and should they be using it and stuff. What's your opinion? I mean, should people be aware of that drug and maybe use it, or you guys have other solutions?
There's actually several FDA approved weight loss medications. Many of them can get 10, 20, 30 plus pounds off if you use them appropriately. I'd say the biggest thing with the medications is if you use them as a standalone for weight loss, they usually don't last long term. Once you're off the medications, unfortunately, many of them kind of start to regain their weight. So that's where you need to, while you're using the medications, start to tailor other things, activity, nutrition, and so forth. There are injectable ones that seem to work real well. There's also then the pill form. Some of them we can get through the insurances, and I think that's why it's becoming a bigger hype, is because more insurances are starting to approve them. So they're becoming a little bit more popular, and there's becoming more of them. One of the biggest things I'd also say about them is that you want to really make sure you talk with your physician or whoever's giving them to you, simply because many of them, they do have potential side effects. They're not common, but you want to know what side effects to look for, which medication may be the best one for you based on, do you have diabetes? Do you have blood pressure issues? If you just have one or both of those, certain medications are going to be better for you, and other ones will be, ones you should not be taking.
Mm-hmm. It sounds like your program is a team effort, and you get support if you're there as a patient and part of the program?
Correct. Yeah, I mean, it really is not just a physician-led, individual person taking care of you. It's a whole program. So where, yeah, you do have physician-led, you have the dietitians, you have multiple PAs and nurse practitioners that help take care of things. We've got the exercise and fitness trainers. It's a whole kind of well-rounded program to start from the very beginning all the way up to the surgeries. Mm-hmm. If needed.
Right. So do you need a referral to come to you guys, or can you just call and sign up?
No, you can just call and sign up, and we're available on the internet. And that in of itself has a fair amount of information on it. It's got videos on it, everything that the program offers.
All right. Very good. Well, thank you, Dr. Bowersock, for joining us today.
Sure thing. Thanks for having me.
All right. Don't go away. Meat Edition continues in a moment.